Good morning, good afternoon, or good evening, depending on where you are in the world right now. Most welcome to this digital event organized by the International Pharmaceutical Federation about community pharmacy roles, services, and tools to minimize impact of air pollution on health. Next slide, please. My name is Lars-Åke Söderlund, a community pharmacist from Sweden and in love with pharmacy since I graduated, and with a passion to support our patients and consumers to a life and health. I am currently the president of the community pharmacy section within FIP and the co-chair of the FIP Congress Program Committee for the World Pharmacy Congress. Next slide, please. Before we start our event, we have some announcements to make. This digital event is being recorded and live streamed via YouTube. The recording will be available on our website, events.fip.org. You may ask questions using the Q&A box provided at the bottom of your screen, and please use the question box and not the chat box for your questions. You are welcome to provide feedback to webinars@fip.org, and this will be most helpful for us as we can improve our future events. And I invite you all to become a member of FIP. It is probably the best investment you can ever make. FIP is the only and very unique global pharmacy organization, and an organization that has had a crucial role during the last 2 years in uniting pharmacists worldwide. I encourage you to become a member of this global pharmacy family, covering science, research, education, and pharmacy practice. And I can assure you that every member of FIP is actually a winner. Next slide, please. Can I have the next slide, please? Anja, can you please give me the next slide? FIP would like to thank the Clean Breathing Institute for supporting this online event. In order to further increase pharmacists' engagement and help them manage the impact of air pollution on respiratory health, we have conducted a series of webinars and activities to provide actionable solutions for community pharmacists. And last year, the Clean Breathing Institute and FIP conducted a survey and produced a report to better understand the role of community pharmacists in managing the impact of air pollution, which has then been followed by training webinars, a Clean Air Week awareness campaign, and a series of roundtable meetings for further identify the meaningful support around air pollution and respiratory health. Next slide, please. Can I please have the next slide? Thank you. So today's program is this introduction, and then we'll be addressing outdoor and indoor air pollution in Kenya, the pharmacy's role in raising awareness and empowering the community. We will discuss the community pharmacist's role in mitigating the impact of air pollution on health, exploring new professional services, and we will also discuss promoting nasal hygiene as an effective way of preventing the effects of air pollution on health. Next slide, please. The objectives, the learning objectives for today's event are: describe the role that pharmacists can play in mitigating air pollution in the community, identify the different tools available to pharmacists to enable the reduction of the impact of air pollution in the community, and to understand the various arrays of services that community pharmacists can employ in supporting better breathing. Next slide, please. The overall aim of today's event is to support pharmacists to play a proactive role in respiratory management of the health impact of air pollution by helping to address their practice and education needs to enable them to provide better patient advice and care. Next slide, please. Next slide, please. Thank you. Air pollution is a silent killer. In 2019, the World Health Organization listed air pollution and climate change as one of the top 10 threats to global health. According to the WHO, air pollution is the greatest environmental risk to health, with 9 out of 10 people breathing polluted air every day. Thus, breathing air that exceeds the WHO guideline limits containing high level of pollutants, with low and middle income countries suffering from the highest exposures. Air pollution is said to be one of the major global causes of death. And with about 91% of the world's population living in places where air quality levels exceed the limits, an estimated of 4.2 million deaths per year are attributed to ambient air pollution due to stroke, lung disease, lung cancer, acute and chronic respiratory illness. And 3.8 million premature deaths are also attributed to smoke exposure from cooking fires, especially in low and middle income countries. So air pollution then kills an estimated of 7 million people worldwide every year. And from smog hanging over cities to smoke inside the home, air pollution poses a major threat to health and climate. And the combined effects of ambient, outdoor, and household air pollution cause, as I said, about 7 or even more million premature deaths every year, largely as a result of increased mortality from stroke, heart disease, chronic obstructive pulmonary disease, lung cancer, and acute respiratory infections. So there is an urgent need for air pollution, not only to be urgently addressed for its devastating effects on the environment and global warming, but also for the direct threat it poses to the health of individuals and communities. And it has a huge impact for patients suffering from respiratory diseases. As such, it is imperative that health systems and healthcare professionals work in synergy to mitigate the impact of air pollution on people's health and quality of life. And in particular, there is an emerging role for community pharmacists in the fight against the deleterious effects on air pollution, not only in responding to and managing respiratory illnesses and symptoms, but also in supporting proactive individual and community respiratory wellness. Next slide, please. You can take the next slide as well. Next, yeah, thank you. So between May and June 2020, FIP conducted the first ever survey on air pollution and respiratory health, awareness and roles of community pharmacists. Responses were received from 62 countries and territories. And in summary, appropriate conditions need to be met for these roles to be fully integrated in pharmacy practice. More education and training, both at undergraduate and CPD levels, are needed to develop the necessary competence. Adequate remuneration models should underpin the sustainability of these services and provide the incentives to adopt them broadly into mainstream practice, and more public awareness of this health threat, as well as the new roles of pharmacists as needed. And appropriate guidelines, regulatory support, and screening tools are also essential to support these roles. And of course, better interprofessional collaboration supported by, for example, shared electronic patient records and etc. would lead to better patient care outcomes. Next slide, please. So today, we will have the opportunity to listen to 3 fantastic speakers, showcasing both the opportunity for new services, but also how community pharmacists play an active role with services and tools to minimize the impact of air pollution on health. Once again, most welcome all of you who are watching this online event, and a special welcome to our three eminent speakers, Dr. Daniela Monene from Kenya, Professor Job van Boven from the Netherlands, and Dr. Emilio Santori from the UK. Next slide, please. So it is now my pleasure and honor to introduce the first speaker, Dr. Daniela Monene from Kenya. Dr. Monene is the Chief Executive Officer of the Pharmaceutical Society of Kenya. She is also the Director of the Kenyan Healthcare Federation, and she is a self-injecting ambassador for the DMPA-SC Access Collaborative. She has extensive experience in quality management systems, organizational regulatory compliance, team leadership, and health sector policy advocacy. She is passionate about ensuring equitable health for all and empowering people to take charge of their own health. Welcome, Dr. Daniela Monene. The stage is yours.
Thank you very much, Lars, for that introduction, and a good afternoon and good evening to all our participants and to my fellow panelists. So as you've heard, I come from Kenya, so I'm going to talk about our situation here in Kenya with regards to air pollution and what I think that as pharmacists, we can do to positively have an impact on the effects of air pollution. And so my address is titled Pharmacy's Role in Raising Awareness and Empowering the Community. Next slide, please. So I'll just briefly mention the global air pollution threat, and then I'll talk about the threat of air pollution in Kenya from the very scanty data that I could find. And then my thoughts on how pharmacists can play a role, especially building from other disease areas that we have expanded into and where we're playing a role. Next slide, please. So these are just statistics I got from WHO, and I found that 3 billion people cook using polluting open fires. And so they're at risk of indoor air pollution. 4 million people die prematurely from illness attributable to household air pollution. And 45% of pneumonia deaths in kids under 5 are caused by inhaled soot. In terms of outdoor pollution, 4.2 million deaths every year occur as a result of exposure to outdoor air pollution. 91% of these deaths are in low and middle income countries such as Kenya, and 91% of the world's population lives in places where air quality levels exceed WHO limits. So this is obviously a problem that really needs attention from everybody in the health ecosystem, probably in the energy ecosystem, because it's greatly contributing to the health of our populations. Next slide, please. So in Kenya, I found a study that estimated that air pollution is responsible for around 5,000 premature deaths in Kenya in 2019 alone. That air pollution is the fourth most important risk factor in driving death and disability combined in the country. And that an estimated 19.9 million Kenyans suffer from respiratory ailments that are made worse by poor air quality. And that's according to our 2017 National Economic Survey. So Kenya is not isolated from this issue of air pollution. We have a very green country, but there's a lot of factors that contribute to poor air and a lot of particulate matter, soot in the air. And chief of those is the vehicles, the emissions from the vehicles. So, but today we're here to talk about how we can help people in our industry, in our pharmacy practice, about how to avoid this kind of pollution and how to improve their health. Next slide, please. So what can pharmacists, how can pharmacists play a role in this? And, you know, air pollution is a new consideration in our practice. We haven't really been trained or conditioned to think about air pollution and the effects of it on our patients or our health seekers. However, we can leverage on lessons that we've learned in expanding our services to areas of health that we have typically not been involved in. And so at PSK and in Kenya, similar to most of the world, pharmacists are expanding their set of services and transforming their practice from just sale of drugs, sale of health products, to counseling, disease management, chronic disease focus, interlinking with other healthcare professionals for proper referral and better care of patients. And so because we've ventured into these other areas, we can borrow the lessons learned because they're universal. And so one of the ways that makes us very uniquely positioned to help patients across a variety of health conditions, including in this area of air pollution, is that we are often both the first and last point of call in the health system for many of our health seekers. So in this country, for sure, we know that a lot of people visit the pharmacy first, and then based on the advice they get from the pharmacy, then they continue with their healthcare journey, or they even terminate it just at the pharmacy. Pharmacies tend to get, on average, 5 times more visits than any other point in the healthcare system. 5 times more visits than, say, a medical practitioner's practice or the lab. And so we are very uniquely positioned based on just the frequency of our interaction with health seekers, and that they visit us first to first present their complaint. And so let's leverage on that position to provide as much services as possible. And one of the low-hanging fruits of these services is simply education. So the same way we educate our patients about the risk factors for their diseases, we can now educate them about sources of pollution. We can educate them about lifestyle risks that would expose them to more pollution. For example, the type of cooking fuel that they use in their home. And we can educate them about mitigation measures and how they can protect themselves. We can leverage on our well-established service, which is medication therapy management. And so if we find patients who have respiratory illness already that probably has been caused by air pollution, or that would be made worse by air pollution after the education, we still need to detect whether they're actually taking their medicines well, and correct any incorrect or irrational use of drugs for this type of illnesses. We can also detect unmanaged and uncontrolled respiratory illness, for example, asthma, for example, pneumonia. If a mother comes in the pharmacy just wanting to, with a baby on her back, and she just wants to get rehydration salts or fever medicine for her baby, we should not just give it across the counter. We can investigate a little more because there might be some respiratory illness going on there. And of course, once we detect that this is undiagnosed or unmanaged, we can manage it or refer or a combination of both. And this requires us to have some linkage with other levels of care, for example, connection to physicians. Again, in this newly thought of area, it's not an emerging area. Air pollution has been with us for a long time. But now that we're putting our focus on it, let us aim to research, document, and learn. And that's what we do in any new area of practice that we venture into. In Kenya, we have certainly begun to encourage our members to get into family planning services, vaccination services. So these are services that have been ongoing for many years, but not from the pharmacy. But now that we're having these services starting to be provided by pharmacists, it's so critically important that we document and see trends and see behavior and see how the services are being received by the health seekers, see their preferences and their feedback, because this will better inform our practice and also better inform policy. So this being a new consideration for us, it's really important that we research, document, and learn to ensure continuous learning and proper documentation to improve current practice and to inform future practice. And I think that's really the end of my slides. We have not thought about pollution, air pollution in our practice, like I said, as Kenyan pharmacists. This is a new consideration, and so these are the lines of thought that I think we can employ to better have an impact on the lives of people whose health has been impacted by air pollution. Thanks very much. Back to you, Lars.
Thank you so very much, Dr. Munene, for a very interesting presentation from Kenya, showing the negative impact of bad or poor air quality, and also the emerging role of pharmacy and pharmacists within our healthcare system as a gateway to care. And I think that this has also been very evident during the last year. And you mentioned in the end, the documentation. And I think that is really important, because documentation means facts. And that is really important in the dialogue with our health administrations or politicians. Thank you so very much. So let us now move on to the next speaker. Can we have the next slide, please? Thank you so very much. Our next speaker is Professor Job van Boven from the Netherlands. Professor Boven is a health economics and real-world drug outcomes expert specialized in lung diseases. He is chair of the Dutch Respiratory Pharmacists Group at the Royal Dutch Pharmacists Association, KNMP, and he is principal investigator at the Groningen Research Institute of Asthma and COPD of the University Medical Center Groningen, and was also task lead for the European Commission funded project Fresh Air that focus on preventive strategies to cope with air pollution and respiratory diseases in low and middle income settings like Uganda, Vietnam, Kyrgyzstan, and rural Greece. Dr. van Boven is author of more than 120 scientific publications, supervisor of 9 PhD students, and received several research prizes and grants. He is an expert of the research faculty of the IPCRG and other editorial board members of various peer-reviewed journals. Most welcome, and the stage is yours.
Thank you very much, Lars, for this kind introduction. And I'm also thanking FIP for inviting me to give this lecture. And of course, I'd like to thank all the attendees for being here, being it very early morning, evening, afternoon. For me here in the Netherlands, it's afternoon, so it's relatively convenient, but I'm pleased to see we have almost 200 participants here, and hopefully we can make some change together. Annikan, could you please go to the next slide? So my talk will be about community pharmacists' role in mitigating the impact of air pollution. And I'm building on to the very great talk that Daniela gave about some opportunities in Kenya and for pharmacists in general, especially focusing on new professional services that we could develop in each and every country around the world. Because I truly think mitigating air pollution, there's nobody yet in the community. We are all community pharmacists, so we have a central role in a community with people living around our pharmacy, and but there's few people in public health or in primary care or hospitals that actually take care of air pollution. So it's actually an unexplored territory where we as pharmacists could expand our roles. And given the high density of pharmacies in urban and rural areas, even in rural areas, we have a very great network of air pollution advocates. And I will shine some light on that. So could we go to the next slide? Next slide, please. Yeah, there we go. So it was already mentioned by Lars, but this is these are some pictures of the Fresh Air project. And of course, these are just some examples of situations and forms of air pollutions that we encountered. And of course, there's overlap between these sources, but it could either be wood for cooking or heating, which was one of the places here. This picture on the left was taken in Uganda when we were working on seeing opportunities for clean cooking solutions. The middle picture is in the UK, where there was a lot of traffic, and I'll get back to a UK court ruling about this. And on the right, we see a picture from Kyrgyzstan, where especially high up in the mountains, animal dung is being used to heat the houses up in the mountains, and this gives a lot of smoke as well inside the house, and small children already being exposed from very early ages. Next slide, please. And this has already partly been mentioned by Lars in the introduction, but air pollution, of course, is a major risk factor for multiple diseases. And I'm just picking out maybe one of the most prominent ones, which is COPD, chronic obstructive pulmonary disease, of which a very nice study from the Global Burden of Disease, published in the Lancet Respiratory Medicine, showed the distinction of different sources of risk factors around the world, but then they grouped this also by socio-demographic index. And COPD is traditionally known in global guidelines as a smoker's disease and not so much an air pollution disease. However, this is only true maybe for some of the high income countries, where indeed over 50% is attributed to behavioral risk, which is basically smoking cigarettes. But if you look then to the lower socio-demographic index quintile, we see that the majority of people having COPD were not even smoking, but they simply were exposed to environmental or occupational risk factors. So it's completely the opposite. And as mentioned, there's so many people that still use solid fuels for cooking and smoking. The next slide, please. Next one. So this is just the focus on environmental and the differences we see around the world in which risk factors play a role. But we should first also know where we're talking about. When we want to be experts as pharmacists, we should know what is air pollution, how do we measure it, how do we define it, and what are the thresholds for a level that becomes toxic or dangerous for the people living in our countries. So there's four main compounds I think you should at least be aware of, and maybe one of the most well-known is the so-called PM2.5. This means particulate matter smaller than 2.5 micrograms. We might be familiar with this with these small particles. As pharmacists, we are of course very aware of aerosol medicine, where we teach and we use inhalers to get particles deep into the lungs, and we know we need some small particles for that. However, our challenge this time will be to keep those small particles out of the lungs. And what are some dangerous levels here? The WHO threshold, for example, is 25 micrograms per cubic meter over a 24-hour mean, for example. On an annual mean, it's 10. And then the second major pollutant is nitrogen dioxide, NO2, for which the threshold that you should remember is in a 1 hour mean of 200 micrograms per cubic meter. That is a dangerous level. We should stay below. Then there's the third one, it's ozone, O3, for which the threshold is 100 micrograms per in an 8-hour mean. And the fourth one you should remember is sulfur dioxide, so SO2, which has a 20 micrograms per cubic meter for a 20-hour mean. But even peak concentrations over 10 minutes, over 500, can also be dangerous. So what have we learned, of course, as pharmacists already in pharmacy school, is to measure. So we are experts in analytics. We know how to find the lowest concentrations of a certain compound in a solution, or we know how to determine the amount of drug. So I think we can expand and use this knowledge to also determine the amount of air pollution in our neighborhood, in our community, and be the person to go to, and also the ones collecting these data, and go to policymakers, to our fellow healthcare professionals. So I think we should really measure air pollution in our own pharmacy, in our own region, in our own community at least. Next slide, please. So this is one of the primary ones, the PM2.5, which has been highlighted, that there's an increase now to over 4 million deaths due to these high levels of PM2.5. And not only deaths, the so-called DALYs, disability adjusted life years, are over 100 million that are lost. But of course, again, we should be aware of the regional variation, because certain regions in the world have higher levels of PM2.5 than other regions. For example, 59% of deaths occurred in East and Southeast Asia, where there's apparently quite high levels of PM2.5 in the air. Next slide, please. And I think this has partly been highlighted. So the many impacts that air pollution have on multiple organs. So I think we all be aware, once we breathe air, the air pollution, that the lungs will be affected. I think it's a no-brainer. We know respiratory diseases, infections, COPD, lung cancer, they've all been linked to air pollution. Also, I think we know that small particles mitigate into the bloodstream and may cause strokes or cardiovascular problems. However, did you also know, and this might be a very important reason to tackle this air pollution pandemic as well, is that it impacts premature birth, and it causes a decreased birth weight of the fetus. So also for the next generation, for our children, we should be aware of air pollution. So it's not only our own health, but also the health of the newborns that we should be aware of with air pollution. And we now see, for example, in the area of COPD, which is traditionally seen as a disease that develops around the age of 40, that we now start to think it's not only about a lifelong exposure to smoking and even air pollution, but it might be that many people with COPD were already exposed in utero. So once they were still growing as a fetus, their growth was diminished. And that's why their lungs did not fully develop when they were born. So this is, I think, in another area we should be aware of. Next slide, please. So I talked a lot about maybe air pollution happening maybe in certain low and middle income countries, but even in high income countries such as the UK, we have seen asthma death occurring due to air pollution. And a very important court ruling was the case of 9-year-old Ella Kiss Deborah. She was a young girl suffering from asthma that died. And at a court, and for a long time it has not been linked to air pollution, but this was a major court ruling stating that air pollution can not only trigger new onset asthma, but also be the trigger of deadly exacerbations or lung attacks of asthma. And this mother was not sufficiently informed on the risk of air pollution while living near in London City, in a very high dense air pollution area with lots of traffic around her. Next slide, please. And we have seen this not only for asthma, so it's not only increasing the disease itself, but also the exacerbation of a disease. For example, in COPD, there's been a recent study in the European Respiratory Journal showing this also in a study in the city of London in the UK, where 115 COPD patients were followed for a mean period of 128 days. And these researchers not only measured PM2.5, but also basically all the major air pollutants that we discussed, including nitrogen oxide and ozone as well. They measured the peak expiratory flow and symptoms daily, and they found that up to 16% increased risk for exacerbations with higher levels of air pollution that we see here, particularly here for the NO2. Next one, please. And we talked about the risk on our health, but for policymakers, of course, money also plays a role. So we should think in economic terms as well. So what's the impact of PM2.5 or air pollution in general on our economic burden on our healthcare system, for example? And this is a very intriguing modeling study from the US, published in the high impact journal PNAS, the Proceedings of the National Academy of Sciences, and Williams et al. Here showed in their modeling that with a 1 microgram per cubic meter increase in weekly exposure to PM2.5, they saw an increase also in the use of the asthma inhalers. So if there's more pollution, people use more inhalers for asthma, which are costly as well, and even causing maybe some more pollution. So there is also some regional and income-based heterogeneity, but what they also then did is calculating if you could reduce the exposure to PM2.5 with only 1 microgram per cubic meter, this would generate nearly 350 million annually in economic benefits for the United States in this case. However, this might be different in different countries, of course, but it's important to link, to make the case clinically, but also economically, because policymakers also think in economic terms. Next slide, please. Yeah. So, and what does the WHO say? What about air pollution or respiratory diseases in their NCD action plan? So what do they consider cost effective is either create by law completely smoke-free environments in all indoor workplaces, public places, and public transport. I know many countries have already some of these regulations in place, but not all countries yet. It should be something to advocate for, of course. Another important one is the access to improved cook stoves and cleaner fuels to reduce indoor air pollution. Cost-effective interventions to prevent occupational lung diseases, so exposure at work. We should try to treat asthma based on the WHO guidelines, and we can provide influenza vaccinations to patients with chronic obstructive pulmonary disease, which is also a role that pharmacists more and more are taking in certain countries, that they are doing vaccinations in the pharmacy as well. Important new role. In my country, it's not happening yet, but I know certain countries, pharmacists are active in vaccinating programs. Next slide, please. So can we help in lowering the PM2.5 by, for example, stimulating clean cook stoves? And this is a study we did in Uganda, in Vietnam, and Kyrgyzstan as part of this fresh air study that you see here. And over 600 people were included, and we gave them a personal measure around their neck. They could measure everywhere where they were 24 hours a day. Their PM2.5 levels were measured, and also their CO, the carbon oxide measures, were measured. And then we also looked at baseline after 2 months, it's the red dots here, and then after 6 to 12 months, so the long-term follow-up. So you see there's a quite important decrease in the exposure that's here on the y-axis. We see the concentration PM2.5, which we see is very high because this is 25 on the left here, this dotted line, this is the WHO threshold for what's acceptable. And you see in all 3 countries, the starting point, so the blue dots, we're way beyond this threshold of 25. But with a clean cook stove, for example, we could at least decrease the exposure for a large part in many of these countries. In Kyrgyzstan and Vietnam, at least, they came around the acceptable threshold of the WHO. Next slide, please. And what about guidelines? Because we as clinicians are used to work with guidelines, I think. And for many diseases, we have guidelines. And for example, for COPD, there are guidelines in most countries. And what are the risk factors mentioned in those guidelines? So one of my PhD students from Kyrgyzstan, she did a systematic scoping review about this. She looked at over 60 national guidelines for COPD around the world. It was published in Chest early this year. And we noticed that smoking is always mentioned in most of the national guidelines. However, air pollution is only around 40% of guidelines clearly stating this as a risk factor for COPD. It doesn't matter if it's a low-income country or a high-income country. This was quite an interesting finding. We need awareness on this. That is an important risk factor, and this should be in national guidelines for diseases. Next slide, please. So this is what I came up with. What can we do as pharmacists, as community pharmacists in particular? And I think Daniela already provided a very good kickoff on this topic. And of course, you will see some overlap because I think we are pharmacists, we think a bit alike. I came up with an easy acronym maybe to remember: SMASH air pollution. And it stands for S, start with your own pharmacy. And I will show you what you can do in your own pharmacy. Number 2, the M, measure air pollution at your local level, because that's what makes sense for policymakers. A stands for advocate for prevention of air pollution in your neighborhood with your policymakers. And the S stands for strengthen your skills and stimulate your peers. So try to be a snowball, expand this opportunity. And then the H stands for help people breathe better. So this is the ultimate effect that we want to achieve as pharmacists. Please note here that I couldn't find any relevant peer-reviewed literature. So on like a PubMed. So these are my own ideas and suggestions from my experience and from, I think, what we could do as pharmacists. And it might depend, of course, on your country and your setting, what will work in your country. So it needs some tailoring. Next slide, please. So let's start with the S, start in your own pharmacy. And why are you doing this? You should lead by example. If you want to lead, you should do it right before you start telling others what to do. So try to practice green pharmacy. For example, you could deliver medicines by electric vehicles or bikes and not by cars that are polluting. Make your pharmacy smoke-free. I think it's a no-brainer. The waiting room smoke-free. I think most countries, maybe this is the case, but if it's not, it's an easy one to achieve. You will help people be aware that smoking is not good. Maybe if you have room for this, place solar panels on the roof of your pharmacy. So you don't need to use any solid fuse or gas to heat your pharmacy or use electricity. And this is important. Make a situation analysis of your neighborhood. So make an action plan tailored to your local community. Identify what are in your community the key risk factors. What are the pollutants? Is it cooking? Is it cars? Is it heating the houses? Anything else? Ask people in your pharmacy, patients with asthma, COPD, other complaints. What are their needs? What would they like to have? Identify stakeholders. Who are the ones that can make change in your neighborhood? Who are the governors? Who are the politicians? But also your fellow healthcare providers, the doctors, the nurses, physiotherapists, nutritionists, maybe. Try to work together and be strong as one team following and set goals for yourself. What do you want to achieve this year, next year, on the long term? Next slide, please. The M, so measure. I think this is so important for policymakers, but also in the Netherlands, we have a saying, it's called meten is weten, it's Dutch, it means measuring is knowing. And it's very easy to state air pollution is high, but policymakers can easily say, oh, that's in another country, it's not in our city is clean, no problem here. So you should measure yourself. And I think the pharmacy as a key central place in a community could be a good place to place just a meter outside or on the top of your pharmacy. It's very cheap to buy, for example, a PM2.5 or air pollution meter. You could place on your pharmacy, showcase these numbers. So look at the screen and see and publish these numbers on the wall. For example, the picture I showed you over the time, over the days, and place the threshold of the WHO and show that it's higher or lower than the WHO level over time. What you can also do, and this may be, so this is a small investment you may have to make yourself to buy a meter, which can be obtained for I think like $20. You have some already. So look a bit at the quality, but there are some relatively cheap ones, and you can already start measuring yourself. You can also make a small business model for this by providing or renting or selling these portable or personal air pollution meters that you can provide to patients so they can use at home as well. So they can measure themselves, how much are they exposed, because the level at the pharmacy may be slightly different than in people's homes. And if you're a bit academic pharmacist and you want to go to a bit higher level, you can even study or clinically evaluate your measurements. So you can compare, for example, your measurements with another community pharmacy in another region and see how these air pollution levels in your pharmacy relate to patient level markers, such as the use of inhalers for asthma. So as we saw in the study in PNAS of Williams, we saw that with 1 microgram per cubic meter increase, we also saw a 1% increase in the inhaler use for asthma, and probably it might be the same. And this is a very strong message if you could show this in your country and your region. So you need to compare them with others. Next slide, please. This is the A, and an A is something everybody can do. It doesn't cost any money. It's advocate for prevention of air pollution. And you can be the first one as a pharmacist probably in your region, because not many people like doctors, nurses, they are not really strong advocates, as in my country at least. It's a role you can take easily without people looking at you. I'm already doing this, for example. So raise some awareness with even a small folder or poster in the waiting room of your pharmacy. It's an easy thing you can do. Raise awareness, inform your patients, but also your fellow healthcare providers, the GPs, the general practitioners, nurses, society workers. And once you have measured, also inform policymakers in your region with your study data and urge them to take action on this. Promote, and this is a thing you can do in certain countries, seasonal influenza or pneumococcal vaccination for patients with COPD. Some pharmacists can maybe provide the vaccination to the doctor or the nurse, and some pharmacists may be able to administer themselves in their pharmacy practice, depending on the region where you live. But it's an important preventive measure you could easily do. Next slide, please. The S, and of course we are wondering, we haven't got any training on this. How can we take this role? So we should strengthen our skills on this, but we should also stimulate our peers to strengthen this. In my country, in the Netherlands, we have just started a training program for pharmacists, community pharmacists, to become specialized respiratory pharmacists. So I'm the chair of the Dutch respiratory pharmacist group. We have now 15 pharmacists being experts in respiratory diseases. And now from this year onwards, we will start a training program for anybody who is interested in also becoming a respiratory pharmacist, where we teach pharmacists on managing of asthma, COPD, but also preventive measures to prevent respiratory diseases, but also learn how to work with pulmonologists in the hospital, with GPs and working on this, and with policymakers in your region. It's a bit of management, science, and clinical practice that you will learn in this program. We also learn how to screen populations at risk. So find in your pharmacy people that very often use, for example, SABA, short-acting beta agonist, like salbutamol, albuterol in your country. This is a sign that people have uncontrolled asthma or COPD, that they need these bronchodilators a lot, which probably means they're suffering from respiratory diseases or signs of air pollution. If you have people using inhalers, make sure they get a proper instruction so that it will actually work, the inhaler. So the inhaler we need to get them into the lungs and not somewhere else. And then always address smoking cessation. It's also a form, of course, of air pollution, especially if it's one of the family members that's smoking and also affecting other family members or children. You don't want to have that. So try to give them even a very brief advice of 30 seconds, advising them to stop smoke, telling them why it affects not only their lungs, their heart, their brain, but also their children, which can be a very important argument. And I know in some Muslim communities, it can also be a religious argument to say smoking is not good. I know in Bangladesh, they have a very beautiful program where they also use religious messages that smoking should not be done and that it's harmful. Also agree with your local general practitioners and specialists on referral criteria. If you find out that some patients in your pharmacy really need to they probably are coughing all the time, short of breath, and they're just getting an over-the-counter inhaler in your practice, or even tablets of salbutamol or theophylline, send them to the doctor to get a formal diagnosis, so they are at least on the radar. And maybe if you become better and more specialized, you can establish a Breathe Better center, which has been suggested as well. And of course, stimulate others, your peer community pharmacies in other regions, in other neighborhoods, to do the same, so that we can create a snowball effect. Next slide, please. H. So this is the ultimate goal. Help people breathe better. This is what we can do as pharmacists. So provide them also with leaflets, with information on air pollution triggers. So what can cause this trigger, especially people that use a lot of respiratory medication, like the inhalers, but or maybe also the ones with oral corticosteroids that have flare-ups or lung attacks, or antibiotics. Provide them with tailored preventive recommendations, good ventilation of their home, use of clean cook stoves and heaters, but also pay attention to environmental triggers if you visit the patient at home. I know some pharmacists are quite active in the neighborhood doing home visits or medication reviews at home. In my country, some pharmacists do this. And this is a good opportunity to also check if they can live very healthy into the house. This is also an easy one. Recommend parents to choose schools that are far away from polluting roads, for example, or areas. Promote good nasal hygiene, saline washes, for example, that could help obstructing from the nose be gone, and small particles, wash them out instead of breathing them in. And then, of course, we learned this during COVID, but you can promote and even sell high quality face masks. There's the NPNR type that can block PM 2.5. So even these small particles are prevented from coming in. This is a typical thing also as pharmacists you could do in smashing air pollution. Next slide, please. Because that's what we can do, I think, smash air pollution, and I hope we can make change. It's now time to smash air pollution, and we as pharmacists should lead by example, in my opinion. Here's my email address if you have any questions. j.f.m.van.boven@rug.nl. Thank you for listening, and I'll give back the chair to Lars.
Thank you so very much, John, for showing us how air pollution affects multiple organs of the body, the negative consequences for young and elderly, and actually how it actually affects even children not born yet. And thank you also for showing us how to smash air pollution with lots of valuable tips and easy actions to improve air quality, and actually how we also can develop community pharmacy services with respect to air pollution. Extremely relevant today, linked to a newly released report about climate change. It is indeed time to smash air pollution. And as you have shown, the community pharmacy can become a Breathe Better center. So can we have the next slide, please? Next slide, please. Thank you. It is now my honor to introduce our third speaker today, Dr. Emilio Santoro from the United Kingdom. Dr. Emilio Santoro is the Medical Affairs Principal Scientist, Respiratory and Skin Health Global Category, GSK Research and Development from UK. Dr. Emilio has worked for more than 10 years in the pharmaceutical industry, as well as the private and public health sectors across Europe. Dr. Santoro holds a PhD in molecular biology and cancer research from the School of Pharmacy at the Nottingham University, United Kingdom. As the GSK partner of the Clean Breathing Institute, Emilio brings his passion to patients' well-being by contributing and leading research projects and educational programs to reduce the impact of air pollution on the respiratory health of people around the world. Most welcome, Emilio. The stage is yours.
Emilio, we cannot hear you.
Perhaps you are muted, Emilio?
Yes, he is muted.
Okay.
Emilio, we cannot hear you.
Mila, can you unmute him?
I'm requesting.
Okay.
But it doesn't work.
Hi, can you hear me now?
Yes, we can.
Yeah.
Oh,
Thank you.
hi. Apologies, but I'm having technical issues connecting through Zoom, so I'm using my phone. Hopefully you can hear me well now. Okay, so thank you very much, Lars, for the introduction, and welcome and thanks for the audience to taking the time for listening to this presentation. I also would like to thank FIP for giving me the opportunity to share with you the data that we summarized in our recent literature review on the role of saline nasal spray and drops in nasal hygiene. And it was interesting to see that Professor Van Bowen just mentioned that this could be an easy intervention to help people breathing better. Now, where did the idea of putting together this literature review came from? Was from numerous discussions that we had with our TCBI experts. And for those of you that are not familiar with the TCBI, this is the acronym for the Clean Breathing Institute, a scientific initiative funded by GSK to help mitigate the negative effect of air pollution on people health. And through discussion with these international experts, we realized that there were three fundamental gaps. The first is that many HCPs often overlook the fundamental role that the nose plays in protecting and maintaining respiratory health. And because of this lack of awareness, then they do not promote nasal hygiene, similarly to, for example, dentists promoting oral hygiene. And finally, the third point was that we couldn't identify a state-of-the-art publication that condensed all the available evidence on the efficacy of nasal saline sprays in maintaining respiratory health. Next slide, please. Now, how did we perform this review? Well, we started with the research question, as I just explained, to understand what was the evidence behind the use of nasal sprays and drops to maintain or optimize nasal functions following challenges from external aggressors such as air pollution, pollen, and viruses. And we concentrated on hypertonic and isotonic saline. We didn't include in the review medicated saline, and also we wanted to focus on small volume nasal saline, so no more than 5 milliliters of saline per nostril, because we wanted to focus on something that consumer and patient could use at ease. So you can carry a small bottle of nasal saline with you. So when we started the search, we identified almost 700 records, 700 publications that we distilled down to 19 articles. And then we also included 10 additional articles from the different searches where we concentrated on Cochrane systematic reviews that we identified 4 of them, but also from international guidance on the use of nasal saline sprays and drops. And finally, we obtained a total of 29 articles that we summarized in our review. I just forgot to mention that the review is published on Rhinology Online, and it was done in collaboration with my 2 GSK colleagues, Dr. Prana Kalita and Pet Novak. Next slide, please. So before I go into the details of what we found in the literature, I just wanted to refresh a little bit on the important role that the nose plays. The appearance from external, it seems quite a simple structure, but actually how you can see here, it's quite complex. And the nose is the first line of defense for the respiratory system, and it has this filtering action that it allows to breathe better air through and down the lungs. And the nasal epithelium that covers the nose, it's full, it's rich in blood vessels that have the action of warming up the air that we inhale. The epithelium is also covered by a layer of mucus that has the double action of trapping particles, but also to keep the air humidified. And finally, the nasal cavity and the turbinates in particular, thanks to their shelf-like structure, forces the air that we inhale against the epithelium and the mucus, increasing this activity of filtering, warming, and humidifying the air. And all these functions played by the nose ensure the best functioning of the lungs, and by consequence, also a good respiratory health. Next slide, please. Now, what happens when these functions are affected by external aggressors that we can find in the air that we breathe? Well, if we think about pollens, air pollutants, and viruses, they can all trigger physiological response in the nose that can lead to nasal inflammation. For example, pollens, through the histamine and prostaglandin release, can trigger inflammation, as air pollutant can do via oxidative stress and cell damage, whilst viruses can initiate the immune response. And once nasal inflammation is happening, then we have a host of nasal symptoms like rhinorrhea, nasal congestion, upper airway irritation, and sneezing. And the health impact of these symptoms and inflammation and impaired nasal functions can vary from the triggering of an allergic asthmatic response or a chronic lung inflammation through a more serious and sometimes life-threatening infections such as pneumonia. And as usual, there are some groups that are at higher risk of getting these negative effects, such as children, pregnant women, elderly people, and people with existing respiratory diseases. Next slide, please. So then, how nasal saline can help in, and nasal hygiene can help in minimizing these effects? Well, as you can imagine, by washing your nose with a nasal spray will enable to remove some of the particles that are accumulated in the nose. And as such, this will help to minimize the exposure to these external aggressors with the surface of the epithelium. Particularly, recognized benefits of daily nasal hygiene include a reduction of these inflammatory stimuli. It can help reducing nasal congestion, allergies, and sinus problems. And it helps improving the mucociliary clearance. That is a mechanism by which the particles that are trapped in the nose are eliminated from the nose. And it can help maintaining the nasal tissues hydrated, so preventing dryness, and importantly, can improve the effectiveness of medicated sprays when nasal saline are used first. Next slide, please. Now, specifically, what we found in the publication that we identified is that in people suffering from upper respiratory tract infection, the daily use of intranasal sprays can reduce the episodes of colds and can improve also the symptoms both in adults and in children. Now, particularly in children from 6 to 10 years with upper respiratory tract infection, the use of intranasal spray up to 6 times a day for 3 weeks in a study showed an improvement in nasal congestion, and also a reduction in the use of medications such as nasal decongestant and mucolytics without any serious adverse event. Again, in children under 2 years of age, the regular use of isotonic and hypertonic nasal sprays helped to significantly improve nasal symptoms, sleep quality, and feeding ability. And finally, the prophylactic use of intranasal saline in children also reduced the number of illness day and school absence compared to a control with no treatment. Next slide, please. Now, in people suffering from allergic rhinitis, there were more randomized controlled trials run in children and adults with either allergic rhinitis or venoconjunctivitis that reported an improvement in quality of life and the reduction of use of topical antihistamine when they were used 2 to 4 times a day, and also reduction in nasal symptoms. And also the use of hypertonic nasal sprays when combined with antihistamine or intranasal corticosteroid showed a better outcome in nasal symptom scores, both in children and adults when compared with intranasal corticosteroids or antihistamine use alone. Concerning healthy individuals, the data showed that the regular use of nasal saline prevented nasal congestion and also allergies. Next slide, please. And finally, in the international guidance that we included in the review, there were clear indication that, for example, for the national healthcare guidance in Canada and France, that recommended the use of nasal irrigation. Now, nasal irrigation, it's a little bit of a higher volume compared to that of nasal sprays. However, these showed, they were recommended to protect from allergens and nasal congestion. Whilst NICE and other recognized international working group also recommended the daily use of saline in children with allergic rhinitis, as they could help treating the symptoms. So again, another piece of evidence towards the positive effects of nasal saline. But can we move to the next slide, please? Now, of course, apart from the data identified in the literature, we also wanted to provide some practical and clinical perspectives from what are actually the experts doing. As such, we discussed with our TCBI experts about what are they doing in their clinics, in their practice. And Dr. Scadding, that is an international expert in allergy and rhinology, mentioned that, for example, nasal sprays are suitable for all ages and even in pregnant women, and that she advised in her practice to patients suffering from seasonal allergic rhinitis to use nasal saline regularly, also because there is evidence that they can reduce the likelihood of symptomatic colds. Now, Dr. Wong, that is a respiratory pediatrician, mentioned that, of course, washing away the irritants with nasal saline can reduce inflammation and irritation. So it's a good thing to do. Also, particularly for infants that are obligatory nose breathers, where upper respiratory tract infection can cause nasal congestion. It can have a big impact on their ability to feed and sleep. So the use of nasal spray can really help relieving these symptoms, improving quality of life of the young children. And finally, the perspective from Dr. Salvi, a pulmonologist, very renowned pulmonologist in India, mentioned that in these times where global warming and a high level of air pollution, and also by just looking at the recent pandemic, where the level of viruses, pollen, and particulate matters are rising, it seems very logical to promote nasal hygiene, because as we can this can help restoring and supporting those optimal nasal functions. Next slide, please. So as a pharmacist, what should you take away from the data and the clinical perspective that we summarized? Well, recommending daily use of nasal spray or drops to your patient. We should educate them that these can be beneficial for keeping their nose clean, to allow their respiratory system to work at best. And this educational point, it's very important, as if even HCPs are not aware, then we can imagine that this will be even more true for patients. So to communicate about, and finally also to communicate on the fact that this is an easy intervention with that it's very well tolerated also in children. So I hope that this has provided you with some interesting practical tips that you can use in your daily work in your pharmacies. And I think I finished here.
Thank you so very much, Dr. Emilio, for a most interesting presentation on how to promote nasal hygiene as an effective way of preventing the effects of air pollution on health and minimizing exposure to airborne aggressors such as air pollutants, pollen, or respiratory viruses is of course important for everyone to reduce associated ill health effect. It was the most valuable update with clear takeaways for every pharmacist. So a big thank you to all of our speakers for excellent presentation. Let's now invite our panelists to answer some of the questions from the audience. So if you have the opportunity, please turn on your cameras again. And I will start with the first question to Daniela. What is the role of the professional associations in ensuring pharmacists play a greater role in reducing the impact of air pollution on health? What do you think?
Oh, thanks, Lars, for that question. As professional associations, I think what we do best is convene people, number one. Number two, it's disseminate information to both our members and our stakeholders. And so similarly in this question about air pollution, as associations, we can capture all the incoming data, all the studies, all the meta-analysis, and present it in a way that we can disseminate to our members through the forums that we have. For example, this forum that's going on here, associations, hold webinars and CMEs, because our members need to always update their knowledge. And so just even looking for experts in this field and bringing them to our members. So I think that's how I would summarize it. Let's convene stakeholders and pharmacists, and then let's collect all the necessary data to disseminate to them. And then let's also look for experts in the field so that they can bring their expertise. The last thing we can do is encourage communities of practice within our own jurisdictions. So for example, Pharmaceutical Society of Kenya, once we get the learnings, from the experts, even from this forum here, I've got quite a few learnings, especially from Job, very practical things that we can do in the pharmacies. Once our members start to implement some of those interventions, we can help them to create communities of practice where they keep sharing knowledge and peer-to-peer learning. So I think we're very key as conveners and facilitating continuous education. Back to you, Lars.
Thank you so very much, Daniela. We have a question here for Emilio, and that is for patients without any respiratory complication, should we recommend nasal saline for preventive care? I don't know if Dr. Emilio is with us or if he's muted.
He's with us.
Yes. Or perhaps we continue with another question then for Job. Job, do you think pharmacists need additional training to provide these new services? And if yes, who should develop and provide these training? And is any form of accreditation or specialization registry needed? What do you think?
I think this can certainly help because I think it's not part of our common training we had at pharmacy school. So it's a partly new topic. And I think we should identify some of the, let's say, local champions who are maybe the furthest ahead in like becoming more like a respiratory specialized pharmacist, and that we work with some kind of train the trainer program. And it could be organized by the local, national, or even international pharmacy association. So what we did in the Netherlands is we started out with like a group of enthusiast pharmacists who were interested in respiratory health and then specialized just by practicing in patients with asthma, COPD, and other respiratory diseases. And then after 3-4 years of having this group together, where we had like 5-6 meetings every year, in discussing what we can do. Now, for the first time, our national pharmacy organization, KNP, we have created a curriculum specifically with learning objectives and a training program of 2 years, part-time, of course, to train more respiratory pharmacists. And they learn from us, but we also invite pulmonologists, GPs, nurses to teach about respiratory diseases, so we can even specialize more. But yeah, I think it's needed. Some low-level things we can do, like being an advocate, having a poster in your pharmacy, but I think for some issues it's good to have more training.
Okay, thank you so very much, Job. And a question related to the first one I asked you. If we develop new services, how should these new services be funded? What actions do we need to take to get the appropriate reimbursement for the quality services we provide in this area?
Yeah, that's an interesting question, and it's hard to answer this, I think, on the global level, because we work with different payment models all around the globe. Partly the train in the Netherlands, for example, I can speak from this experience. We have the training will partly be funded by the government also as an accredited training, and we will have a registry for these pharmacists. They are officially then become respiratory pharmacists, and yeah, we have kind of funding for education in this for healthcare professionals, which is covered. And then it depends on your own business model in your pharmacy, whether you can charge for services or just for medication. In the Netherlands now we have a double option, so you can get paid per medicine you dispense, but there's also certain fees you can charge for counseling or medication reviews, and it could be part of those special actions you take, and this is, I think, a very national or even local procedure in how it works exactly.
Thank you so very much, Job. I don't know if Dr. Emilio is with us, but I have a question for all the panelists. Do you think that in general, the public or consumers are actually aware of this serious problem with air pollution and its impact on respiratory diseases?
Hi, I don't know if you can hear me now. Is Emilio
Yes,
there?
we can. Excellent.
Oh, sorry. Yes. Well, if I can answer the question, I would say probably raising awareness. It's an important step, both with experts and patients. It's always better to know what you're trying to fight, because then you can take preventative measures to minimize the exposure to air pollution that has been also shown during these presentations today. Has got a very detrimental effect not only on respiratory health but on a lot of other non-communicable diseases.
Yes, thank you. And we had another question for you earlier. It was for patients without any respiratory complication. Can we recommend nasal saline for preventive care?
Well, I think that the answer to that question, based on the data that we showed, it's definitely yes, because particularly if people live in areas where there are a high level of air pollution, and as also Dr. Bowen has showed in his presentation, even a small reduction, or actually even a small increase in the number of particles per cubic meter can have an impact. So then we can definitely think that a reduction of the exposure of the particle that concentrate in the nose by mechanical removal through nasal washes can provide some benefit, even if people don't suffer from any respiratory condition. And there is some evidence that it can be used preventative to reduce the number of cold episodes. So I think it's about promoting nasal hygiene and helping people to understand that keeping a nose healthy helps protecting the respiratory tract. At the end, it's a one respiratory system, right? So it starts from the nose and it ends in the lungs. So I think the answer to that question would be yes.
Yes, thank you so very, very much. We have another question here for Job, I can assume, and that is actually what would be the incentives for pharmacists to engage in these new air reduction services? And a link to that, when it comes to smoking, you talked about smoking, how to prevent and avoid pollution of passive smoking. I guess you have answered that question to the person who actually raised it, but perhaps you can repeat it here in the session for everyone.
Of course, I put it in the Q&A session. Of course, the first thing we should do as pharmacists is also recommending people to stop smoking. But in case this is not working directly, we could try to influence their behavior indirectly, at least by making them aware, for example, of the detrimental effects on their children's health or their partner's health, and advising them, at least if they don't want to quit, at least to smoke outdoors from their house or on the balcony or with the ventilated window open instead of next to the children, for example, in the living room. So this would be some advice, but of course the main thing is to make them stop, but advise them to stop smoking. But if this is not possible, maybe the second best is to prevent that they smoke in the area of others, especially their loved ones.
Yes, I agree. During the last year, we have almost in every country been using face masks to protect ourselves from the COVID-19 disease. And we have a question here, perhaps you can answer it, all of you. Taking or using masks can also create breathing problems. How can we control this situation if we use the masks and at the same time suffer from a respiratory disease and living in polluted area? Any recommendations?
Yeah, it's a difficult question. It's a trade-off, of course, in breathing, because I think with normal breathing, and it depends really on the masks. There's so many different ones, and I agree. I tried myself multiple ones. Some are more dense and tight than others. And so I think it's a bit of trying to tailor which one fits better for people. But I think preventing dangerous, not only air pollution particles and COVID particles, preventing them to come in, at least people should wear them in areas with other people and with high polluted areas. But in other areas, you may take the mask off. And I think it also depends if you are doing exercise or not. So if you're heavy exercise, then the breathing problems become worse.
Yes.
So I think it's a trade-off between choosing the right moment to wear the mask. And if you're like playing sports with no other people in the area and in more clean areas, you don't need to wear it. So I think it's possible to still wear the mask to avoid the highest risk.
Exactly. Thank you so very much. And thank you so very much to all of you. I see that we have now a new slide on the screen. So I would like to thank all of you for attending this digital event today. I want you to remember that you have the power to make a change. Community pharmacy really has the potential to become a breathe better center. We have learned today that there are many actions we already can take today. We are aware of that advocacy tools tailored to reflect each country's unique situation, etc., could help with efficient sharing of key messages and, when complemented with public-facing campaigns, have a real and tangible impact on building awareness on the pharmacist's expanding role in this area. And I think that our presentations today have really showcased this. The need for strengthen and formalize continuing professional development for pharmacists is also a significant focus. But I think that a common thread is the need for the role of pharmacists to be fully recognized within healthcare as key actors within our healthcare systems and to the wider population as well. And this has been highly showcased also globally during the last year with the COVID-19 pandemic, where pharmacy more than ever has been perceived as an essential actor within our healthcare system. And as such, I'm very happy to see a growing interest from community pharmacy as well in the area of air pollution and respiratory diseases. So with regard to this slide, I would like you to invite you to join us on the 7th of September, the United Nations International Day of Clean Air for Blue Skies, leveraging pharmacies to minimize the impact of air pollution on health, policy barriers, and drivers. We are now aware of that there is an evolving role for community pharmacists, not only in reactive respiratory illness, but also in supporting proactive individual and community respiratory wellness. However, what needs to change in terms of policy and regulation for these roles to become part of a mainstream pharmacy practice? So this symposium, the coming one, will mark the United Nations International Day of Clean Air for Blue Skies by addressing the drivers and barriers for the full deployment of these services, and of course to discuss the key points of the FIP to call an action on this global health priority. So do please attend. Next slide, please. So I think that the pandemic has highlighted how we are all connected across borders and has also emphasized the value of solidarity among the pharmacy profession. And I would like to thank all of you for attending today. And also on behalf of FIP and the Clean Breathing Institute, I want to thank all the speakers for their wonderful contributions, for sharing their experience and expertise, and giving us so many wise comments and recommendations for immediate actions. And I would also like to thank all of you for attending this very important event. We are committed to working together to truly change people's lives and to reduce the impact of air pollution and its negative effects on health. Can we have the next slide, please? Yes, please follow us on our website. We have a number of digital events coming up during the coming year. And during 2021 and until February 2022, we have approximately 200 digital events, and all are free of charge. And this is the most valuable source for competence development. So don't miss this golden opportunity. Next slide, please. So thank you once again for attending, and thank you to our fantastic speakers, and thank you also to the Clean Breathing Institute for sponsoring the event, and to all of you who have attended this event today. I look forward to meet you all soon again, and don't forget, you are all an essential part of our healthcare systems, and as such a true hero. Pharmacists have done an excellent job during the pandemic, and as an essential sector, pharmacy, you have all supported the entire public model from the point of view of prevention, screening, advice, support for vaccination, pharmacovigilance, etc. And therefore, from here, my recognition to all of you who have acted with great professionalism and with maximum involvement. Now you can become an agent of change with regard to air pollution and respiratory diseases. Thank you so very much, all of you, for attending today, and I wish you a good day. Goodbye.